One day in early August this year, an 18-year-old girl carrying her first pregnancy went into labor. When her water broke, she was taken to KEMRI Sub-County Hospital in Migori County. At the hospital, she was given medication for a urinary tract infection and sent home by staff at the hospital who told her that she was not ready for delivery yet, according to her mother.
Alikuwa na uchungu, akakaa, walifika usiku saa 2. Wakamhudumia, wakampea madawa, wakasema huyu utarudi naye nyumbani. Wakarudi kwa nyumba ikiwa saa 5 ya usiku. Saa 6, saa 7 amesidiwa sana. Wakarudisha tena. Sasa kurudisha huko ndio wakaenda wakapata mtoto, akachifua pale chini, mtoto amechoka na akakufa.
Ngusiro, not her real name, said that her daughter was accompanied by her sister to the hospital and witnessed the excessive bleeding. She left for hospital and arrived at 5 in the morning.
Sasa nilifika huko kitu saa 11. Tangia nilienda huko mimi sikuona mtoto wangu. Mpaka saa 6 ya mchana. Ndio waliniita sasa kwenda kuona maiti.
Ngusiro was devastated that her daughter had been turned away the first time instead of being attended to. Now, her daughter had lost the baby and was bleeding excessively in theater and needed blood, which the hospital did not have. Staff even asked her to fuel an ambulance that would go for the blood.
Tunahitaji damu nyingine aongezewa. Na hiyo damu yake tumeulizia tumesikia iko kwa hosi nyingine. Na hiyo hosi lazima tutumie fare kwenda kuitafuta. Niweke fueli kwa gari ndio waende hiyo damu sasa. Waliniambia wanaenda kuitafuta Sirari. Nikawauliza ni shilingi ngapi, wakaniambia ni shilingi 2,000. Nikawapea.
After fueling the hospital ambulance 2 times, it would later occur to Ngusiro that it was all a con, as she saw the ambulance driver within the hospital. Frustrated, she asked to donate blood for her daughter.
Akakimbia haraka akaenda akaniandikia barua. Sasa nikapeleka hiyo barua kwenye alikuwa amenituma. Sasa kufika huko nikasema kweli hata kama si kusoma faidi, kuna kitu kweli singeweza kujua kwa hii barua. Nikatoa tena yule sisa ile barua. Nikaangalia, nikaona wameandika blood for replacement.
Ngusiro confronted the doctor and it was then at noon that they decided to break the bad news that her daughter was no more.
Kwa vile sasa linanisumbua zaidi. Maswali yenye najiuliza nani ni mengi sana. Asindikisha mtoto amekufa na msindikisha na pesa.
The lack of blood at KEMRI Sub-County Hospital, a level 4 hospital, is not unique in Migori. Such strife is widespread across the county. Lack of medical supplies, blood, and shortage of staff is emblematic of the healthcare sector in Migori County. This has left many with poor access to healthcare, a situation that is partly born out of corruption. The Ethics and Anti-Corruption Commission continues to recover over 400 million shillings embezzled by the former Migori Governor Okoth Obado. The impact of corruption on healthcare access in the county and what the funds would have meant for this county had it been prudently used continues to be felt by its most vulnerable. On a typical Saturday afternoon, Otati Health Center in Kanyadianga village is dead quiet, save for a few cows grazing in the compound. The gate remains closed and so are the doors. Otati Health Center is one among the 167 public health facilities in the county and the only one that residents of Kanyadianga and beyond depend on as the first point of healthcare. However, residents say that health workers in the health center are few. The health center hardly stocked and is closed over the weekends.
Na hiyo hospitali inasaidia watu wengi kutoka Homa Bay na Migori. Sana sana unaweza pata watu wa Homa Bay na kuwaga wengi kuliko watu wa Migori juu. Boundary hapa saidi ya pande hakuna hospitali kwa pande Homa Bay. Ni mbali ukitoka mpaka huko mahali inaitwa Magonga. Sasa ile yote mpaka chini huko unakuja hapa. Na shida ni dawa ni kidogo. Dawa ikiletwe wiki moja dawa imeisha juu watu ni wengi. Sasa kama tungekuwa tunaweza pata dawa mingi na waongeze madaktari, itakuwa mzuri.
According to Harrison Doyo, Otati Health Center is constantly out of stock of critical medicine.
Hata sasa hakuna dawa kwa hii dispensary. Ukikuja hapo wanakuandikia dawa, wanasema enda tafuta hii mahali fulani. Unaweza pata zingine hata ya malaria peke yake kuna. Ya malaria iko hata makuna. Panadol hakuna.
Rosemary Adhiambo recently took her niece to Otati Health Center for delivery. The lack of bed space and lights at night made it difficult.
Hatuna taa hospitali. Sasa ni mtu anajitetea kwa taa yake. Pengine umekuja nini hospitali hujabeba taa, sasa hapo ina daktari at least anapata shida kwa kusaidia. Shida ni hatuna vitanda, hatuna building. Watu wakienda hospitali tunachanganywa, mama na wababa, watoto, wajawazito wenye wameenda kuzaa pia. Tunachanganywa kwa building moja.
Riat Kung'ou Health Center is 6 kilometers from Otati Health Center. The facility was built in 2021 but has never been staffed or stocked. If it worked, many residents of the larger Kanyasa ward would have benefited from it.
Kwa hii yote tunaye tu hapa structure ilijengwa hapa at dispensary mwaka iliyopita, sijui kama ni kama mwaka wa 2021, lakini tangu hiyo siku hata tangu hiyo miaka hadi saa hii hatujaona kitu kama madawa. Hakuna hapo kwa structure, daktari hakuna, watu waendie kwa hapo kwa usaidizi yote hatupati hapo. Sijui ni nini bana hiyo structure iko tu hapo, lakini ni structure tu, hakuna kitu yoyote.
Anita Musiega, a health economist with KEMRI Wellcome Trust, said that the embezzlement of public funds is trapping Kenya to aid dependence. She said that the Global Fund has reduced funding for HIV in Kenya by $53 million annually. If equally shared among counties, every county would receive about $1 million each.
It means Migori would be able, or Migori or any other county, if their governor or if the people who they have entrusted power to are not stealing, it means they will be able to bridge that gap that the Global Fund has left behind.
Migori County has a high HIV prevalence of 14.3%, nearly 2.5 times higher than the national prevalence, according to 2018 data by the National Syndemic Diseases Council (NSDC). According to Musiega, Kenya has over 1.3 million people living with HIV, requiring antiretroviral drugs worth $15 or 1,950 shillings each every day. But Kenya only funds less than a third of its HIV response budget, depending majorly on the Global Fund and other donors.
There is an estimated rate per month per patient of, is it around $15? If you look at that $1,500, if you look at it in the grand scheme of things, it's such a huge amount in terms of what it can be able to do for the people of Kenya.
Besides what the amount can do for people living with HIV, just 5 million shillings could have purchased 2 advanced heart scanners and 4 ultrasound machines. One ambulance costs between 13 to 16 million shillings, meaning that the recovered funds could easily purchase 26 ambulances, critical for a county where mothers sometimes give birth by the roadside during transport to hospitals.
So that's 200,000 at the end of the year for a quarter, and there's no guarantee that it will come every quarter. You will probably get it once or twice a year. So that's 400,000. So that 400,000 for one facility, for the medicines they need for the entire year to serve maybe 10,000 Kenyans. So you can just do the math, 480 million divided by 400,000. So there's thousands, probably 1,000 facilities.
In 2022, research found a critical shortage of healthcare workers in Migori County. With a population of 1.1 million people, it had 987 clinical officers, 153 doctors, and 2,423 nurses. Migori County would need 1,100 doctors to adequately serve its population according to the World Health Organization recommended doctor-population ratio. At 153, they have a deficit of 947 doctors. 400 million shillings would have doubled the county's number of doctors for 1 year.
If you think about each staff, especially for the nurses and clinical officers, they probably earn 150,000 a month on the higher side. So at most they cost their county, if you add pension, etc., around 4 million.
Just this month, the Ethics and Anti-Corruption Commission EACC auctioned Obado's apartments in Riara and Greenspan in Nairobi, along with a townhouse in Loresho Ridge, realizing only 69 million shillings. In Migori, residents like Oyugi hope for better leadership that will prudently utilize public funds for better health access.
Tungekuwa na uongozi bora hizo miaka yote iliyopita, hospitali ingekuwa inafanya.
The Obado case, therefore, is an eye-opener on the real impact of corruption on the ability of ordinary citizens to access healthcare, especially when the amount is tallied against the real healthcare outcomes that have been missed as a result of the loot. Anthony Langat for Willow Health Media.